Welcome to the abdominal assessment video. Before you start the abdominal examination, you need to provide your patient privacy, perform hand hygiene, and explain the patient what are you going to do. Before you start to examine the abdomen, make sure that your patient has emptied his bladder. The equipment we need is a stethoscope, and also we have to remember that we're switching assessment technique. We're doing inspection first, auscultation second, then percussion, and then palpation. We have the patient lie on his back and we're going to ask him some questions. Are you having any stomach issues, constipation or diarrhea?
Nothing recently.
When was your last bowel movement?
Just this morning.
How are you urinating? You have any pain?
No pain.
I'm inspecting the patient's skin for scars, rashes, ecchymosis. I'm inspecting the symmetry and contour of the abdomen. Is it flat, rounded, or protuberant? I see no bulges, no signs of inflammation, no hernias. Now we are ready to listen to bowel sounds, and we're using the diaphragm of the stethoscope. We're going to start with the right low quadrant and move clockwise. We're going to listen all 4 quadrants, and you should hear 5 sounds per minute. And if you don't hear any bowel sounds, then you need to listen for full 5 minutes. And you need to know that bowel sounds can be normal, hyperactive, or hypoactive. Let's listen. We're going to move to upper right quadrant. Then we're moving to the upper left quadrant. And then moving down to the lower left quadrant. The bowel sounds are normal. Now we're going to listen vascular sounds, and we're going to use the bell of the stethoscope. We're going to listen the aortic artery, renal arteries, and iliac arteries. And if you need to listen femoral arteries, you can do it also. The aortic artery is a little bit below the xiphoid process. We are listening the swoosh sound, and it's not noted. Then we're moving to the right renal artery and left renal artery. When we're moving to iliac artery, and it's a little bit below the belly button. And then listen the other side either. Now it's time for palpitation. First we're going to do light palpitation and then deep. And as I'm gonna do this, please tell me if you feel any tenderness or pain. We start with the right low quadrant, and we're going 2 centimeters deep. And you're just feeling any masses, lumps, rigidity, and stuff like that. When we're doing deep palpitation, we're going 4 centimeters deep. And you can use both hands to feel all these masses. You feel anything?
Nothing right now.
It feels nice and soft, and I can hear some belly sound. And that's why you do it after listening, as you can stimulate the bowel sounds. A Additionally, you can examine the spleen, liver, and kidney. To palpate the normal size liver sometimes can be difficult. The only portion of liver you can palpate is the liver border, as the upper size of liver is just protected by the rib cage. There are some techniques you can apply it, and the scratch test is one of them. Examining the spleen can detect the splenomegaly. The normal size spleen is usually not palpable in healthy adults. The percussion of the kidney is usually done at the end of assessment and help nurses to detect pain and tenderness. You have to put your patient in a sitting position and put the palm of your hand over the cursed vertebral angle, which is the 12th rib of your rib cage, and strike it with the ulnar surface of the fist. Usually there is no tenderness over normal kidneys. This wraps up the abdominal assessment, and I hope you find this video helpful.